I'm with Dr. Gary Wu. He is the moderator for Combined Translational Symposium. I believe it's Monday, on the future of technology in FMT. Now tell me, what is the future of technology when it comes to FMT?
Well, I think it's sort of the life cycle of fecal microbiota transplantation. Currently we use stool to inoculate individuals to treat refractory Clostridial difficile infection.
Sure.
But I think the future, the next step would be sort of defined stool, sort of more purified stool from defined donors that would be processed and then delivered as a product. But then the real next generation of products will be defined groups of microbes, individual organisms that you grow together in a laboratory,
Right.
and then you could use those to inoculate individuals for the treatment of not only C. diff infections, but probably other types of diseases. You could think of it as maybe the next generation of probiotics.
It's almost like proof of concept has been shown through the treatment of C. diff, and now you can move on to other illnesses.
Exactly, but there's a long road ahead. I mean, one of the challenges in the field, quite frankly, is that we have a lot of information showing functionality, cause and effect relationships between a microbiota and disease in animal models. We have a lot of associations in human subjects. Where we need to get to is actually doing proof of concept studies
Right.
to show an effect, a functionality of the gut microbiota in human subjects. Now that's why FMT is so important in Clostridial difficile infection, as you point out.
Well,
it's proof of concept.
Well, yeah, and C. diff right now is so epidemic in nursing homes, other institutions across the country. Will it continue to play a major role in treating C. diff?
I think so. I think the use of stool right now is sort of an intermediate step. But once we come up with better types of products, that we have a better defined group of organisms, we know what they actually do and what they actually are, then I think there is tremendous benefit into using these types of microbial products for the treatment of FMT, because one of the major things that we're facing now with Clostridial difficile infection is antibiotic resistance.
Yes.
So this is one way to sort of manage that problem moving forward in the future.
What would you say to all the practicing gastroenterologists out there? How do they benefit by learning more about this?
Well, I think it's really important because you're treating your patients, right? And your patients have to have informed consent. So you must understand a little bit about the biology of what you're actually doing to your subjects, not only for your own good, but also for your patient's good. So you should understand both the benefits and potentially the risks of doing FMT as it is right now, using stool. But also, I think it would be of extreme interest to the clinicians who are doing this of what's the vision for the future.
Exactly.
Like in the next 10 years, what are we going to be doing? It's probably not going to be stool-based. It's probably going to be a little bit more sophisticated than that.
It'll be this particular organisms or particular proteins perhaps, or cell structures that are producing that's normal flora?
Yeah, so stool is probably one of the most complex microbial communities. And one has to recognize it's just not bacteria, but they're viruses, they're fungi, they're yeast, they're all types of organisms, many of which has never been characterized. And it's a living consortium of organisms that can change over time in ways that we cannot predict.
It's such a natural way to treat, and it's such a source of potential that we've never taken seriously enough, I guess. Can you think of other illnesses, other infections besides C. diff that may one day be approached with this?
Well, so there is a lot of interest in inflammatory bowel disease because we know that the gut microbiota is abnormal in inflammatory bowel disease. Other areas of interest in even metabolic disease like type 2 diabetes. And even there is some interest in autism spectrum disorders, with the notion that the gut microbiota may be producing small molecules or metabolites that may actually affect the central nervous system. Now these are all exploratory right now. Nobody should be doing FMT for that unless it's in a controlled clinical trial.
But it sets the stage for all this potential. I mean, you look at probiotics, for instance, and if that could be given more credibility in a scientific framework, that would be fascinating.
That's exactly it. So, probiotics right now are largely organisms that were used to make fermented milk products. but using all the knowledge that we have gained over the past decade in the
really make a
microbiome,
difference.
you could actually develop specific types of probiotics, the next generation probiotic to treat disease.
Wow. Thank you so much, Dr. Wu, for being here. Really appreciate it.
I'm delighted to be here.
If you'd like to follow us on the web, please visit our blog for DDW, and you can also follow us on Twitter. Our hashtag is DDW14.